Today I'm going to discuss the Smart Lipo laser, which we have right here, and why it's beneficial and why you may want to use it for your procedure. The laser we use primarily for skin tightening purposes. Now, with that said, it does have other benefits including it reduces the blood loss during the procedure by coagulating blood vessels. It tightens the skin, as I said. It also helps to reduce dimpling from cellulite. It'll help reduce the appearance of stretch marks, and it's also been shown to speed up the healing process and make a quicker, easier recovery. Now, the procedure is quite simple. We use the laser along with liposuction, and what we're going to do is we'll numb the area similar to how we numb with liposuction. We use a tumescent fluid. Then we're going to take this small instrument here. This is called a cannula, and we have a fiber optic cable that comes from the machine here and goes through the instrument. The instrument here is basically it's stiff. The cable goes through it, and there'll be a little tip of the fiber sticking up at the end. It'll be red, a red light, and essentially we're going to pass this underneath the skin, and it heats up the inner surface of the skin, causing a contraction. Studies have been shown that the Smart Lipo laser stimulates collagen growth for about 6 months after the procedure, so you'll continue to get thickening and tightening of the skin for 6 months after the procedure. Another study shows that the use of the laser can get you up to 57% more skin tightening than liposuction alone. So ultimately, if you are concerned about looseness of the skin and it's within your budget, the use of the laser is by far the best way to go. If you can't afford the laser, focus on the liposuction. You're going to get bigger, more dramatic results with the liposuction. The laser is one of those things that's fine-tuning, so you're going to get thicker and tighter skin with the laser. It's a premium. So if you can afford to get the best option, the laser is the way to go. If you can't, stick with the liposuction. You'll get good results as well. The reality is, nobody needs any of these procedures. These are all elective. So it's all what you want and what you're concerned about. If you are concerned about the looseness of the skin, then the laser's the right thing for you. If you have very tight skin, you probably don't need it. It's not necessary. But if you are perhaps older, maybe in your 40s, your 50s, your 60s, these people tend to have looser skin. And things don't get better as you age, it only gets worse. So if you're concerned now with looseness of the skin, it's a good idea to address it now to hopefully have tighter, thicker skin later in life, and to slow down the aging process. Now, which areas do we use the laser on? Well, it's indicated wherever you have loose skin, so that could be any area on the body. With that said, there are particular areas that people are more concerned about and more likely to use a laser in. For example, the chin. It's your face. Everybody wants the best results on the face. You want the tightest, thickest skin on the face, so that's an area that people primarily use it. The underarms. Women hate that waddle, that loose skin flapping under the underarm. That's another area that's very commonly used for laser. The inner thighs. Inner thighs tend to be very thin skin naturally. So using the laser there would be very beneficial in getting you thicker, tighter skin there. Many women like to use it on the outer thighs, the knees. These are areas that typically have more cellulite. The laser can help not only tighten the skin, but it reduces the cellulite as well. Those are also good areas. The abdomen, front of the abdomen, is typically more of a concern than the outside of the abdomen, the love handles and the hips. But it's totally up to you. If you're concerned about looseness of the skin, we can do it anywhere you want. Most people really want to get rid of that belly folding over. Laser is the best way to do it. Now, I do recommend treating the entire front of the abdomen for the best results. And the thought process behind that is that you may only notice the skin at the lower part of the abdomen, but in treating the upper abdomen as well, it's going to pull everything up, and you're going to get more tightening and further increase the chance of getting rid of that belly hanging over.